Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Huria Amir. Today we are going to learn about pain. Now, what is pain? Pain is actually a protective mechanism and it is actually protecting our body from different damaging things which are taking place inside our body, damaging from outside our body. It is actually a sensation of discomfort. Now, how it occurs? It is actually the sign that there is some damage to tissue occurring. Now, let's talk about the different types of pain and their qualities. We have fast pain fibers, we have slow pain fibers, and they are being classified into two major types, the fast and the slow ones. The fast pain is felt within about 0.1 second after a pain stimulus is applied. It is said fast. Why? Because it is being felt fast. So whereas the slow ones, they begin only after 1 second or more. So we have to know that what are the things which actually do cause the fast pain fibers to be stimulated. Well, mostly the stimuli for the fast pain fibers, they are thermal and mechanical. They are being carried by A delta fibers and they're being carried by the spinothalamic pathway. The localization is quite good. The velocity is between 6 to 30 meter per second and the neurotransmitter over here is glutamate. Now, let's talk about the slow pain fibers. Now, these are actually the long-acting fibers and mostly being done by the chemical stimuli and they're being carried by the C-type of fibers. And the substance over here, the neurotransmitter, is substance P. So what we have to learn is that for the fast pain fibers, we have the neurotransmitter glutamate, whereas for the slow pain fibers, we have substance P, which is the neurotransmitter. Now let's talk about the fast pain in detail. The fast pain is described by many alternative names like that it is actually a sharp cutting type of pain, it is pricking type of pain, there is acute pain, there is electric pain. So this type of pain is felt when a needle that is actually, for example, stuck in your skin. And when the skin is cut like with a knife or acutely burned, so it is actually felt to us as if there is some electric shock. There is a fast cutting sharp type of pain and it is not felt in the deeper tissues. This is actually mostly felt over there in the superficial tissues. Now, what is the slow pain fibers? What is the slow pain? Slow pain is actually being perceived by the slow pain fibers. They are long acting and mostly by the chemical stimuli in the deeper tissues and the slow burning type of pain. It is aching type. It is always there. It comes and goes. It is nauseous. It is chronic. It is dull and it is not sharp. So this type of pain is usually associated with tissue damage, tissue destruction, and it can lead to a prolonged and almost unbearable sort of suffering. It can occur both in the skin as well as in the almost deep tissues or organs. Now, what are the pain receptors? As we have done up till now, the classification of receptors, you have learned a lot about different type of nerve fibers, which are actually modified to form different type of receptors, like you have done Ruffini's endings, Merkel discs. We have different type of other fibers, but remember that for the pain receptors, for the sense of pain, there is always presence of free nerve endings. The pain receptors in the skin and other tissues, they're all free nerve endings. They are widespread over there in the superficial layers of the skin as well as in deep tissues, like you can say over there in the walls of the arteries, in the periosteum, over there in the joint areas, then over there in the cranial cavity over there, in the fox as well as tentorium. Then, so that's why any widespread type of tissue damage can summate or can add up to cause the slow chronic aching type of pain in most of these areas. So it is actually a sort of protection for all of us. Like for example, if there is heart attack, which is quite a deep structure, heart, So if there is any sort of obnoxious condition over there, there is lack of blood supply, there is sort of obstruction to blood supply over there. So what happens is that there is accumulation of lactic acid, and that is actually the alarming sign. There is actually, as you can say, that there is arousal of these free nerve endings, and they are going to tell us that by means of this sense of pain that the patient or the person who is suffering should do something. So there are three types of stimuli which can excite the pain receptors, which can be, we all know, mechanical, obviously, thermal, you all know that heat as well as extreme cold. Then we have the chemical pain. And remember that the fast pain, the sharp pain is always acute pain. These all type of pains, they are by the mechanical and thermal types of stimuli, whereas the slow pain can be elicited by all the three types, but most of the time by the chemicals. So there are different type of neurotransmitter, there are different type of chemicals which are responsible for different type of pains. So we should be knowing them, especially glutamate, substance P, bradykinin. These all in things like, the bradykinin, serotonin, histamine, potassium ions, the acid, acetylcholine, proteolytic enzyme. So we should learn that substance P, the prostaglandins, they actually enhance the sensitivity of pain endings, but so do not actually exciting them. The chemical substances are especially important in stimulating the slow suffering type of pain that occurs after tissue injury. Now, as up till now, what we have learned in the sensory system, that there is a sort of adaptation regarding the different sensations, but regarding this pain sense, we have no adaptation in nature. The pain receptors adapt very little and sometimes not at all. In fact, why? Because it is protective in nature. It continuously tells us that we have to save our deep tissues or some superficial tissues, something wrong is going on and we have to cater it. So under some conditions, the excitation of pain fibers become progressively greater, especially for slow aching, nauseous pain, as the pain stimulus continues. And this increase in sensitivity of the pain receptors is called hyperalgesia. So hyperalgesia is quite an important term regarding different scenario type of questions which can do come in your SCQ portion. So all of you should know that if a person is having increased sensitivity of pain receptors, he or she is suffering from hyperalgesia. And we have to mind it that the level of sensitivity of pain receptors is different in different individuals. It is not the same. The importance of this failure of pain receptors to adapt, because it allows the pain to keep the person apprised of a tissue damaging stimulus as long as it persists. Now let's talk about what is the rate of tissue damage as a stimulus for pain. The average person begins to perceive pain when the skin temperature is above 45 degrees centigrade. This is also the temperature at which the tissues actually begin to be damaged by heat. We all know it, that at this temperature, the tissues, they eventually start to be destroyed, and rapidly this temperature has to be taken down if we want to maintain the homeostasis of that person. So it is immediately apparent that pain resulting from heat is closely correlated with the rate at which damage to the tissue is occurring and not with the total damage that has already occurred. So it is actually telling us that at which damage it is actually telling us the rate at which the damage is actually occurring. Now, there is always a special importance of chemical pain stimuli during the tissue damage. The extracts from the damaged tissue, they cause intense pain when they are being injected beneath the normal skin. It is actually being seen during some sort of experimental physiological study to know that what is actually the cause of pain and why it is being perceived. So this thing that the extraction from the damaged tissue, if we inject into a normal skin, there's a feeling of pain, shows that there are some chemicals which are exciting the chemical pain receptors. And some of them are like bradykinin, substance P, glutamate, etc., different NEEN products. So one chemical that seems to be very painful rather than the other ones, that is the bradykinin. So bradykinin is actually the agent which is most of the times responsible for causing the pain. The intensity of the pain correlates with the local increase in potassium ions or the increase in proteolytic enzymes that directly attack the nerve endings and they excite pain by making the nerve membranes more permeable to ions. Now look at this graph. You can see that as the temperature increases, there is more susceptibility of excitation of the free nerve endings, and it goes like from 44 to 47, because at this level what actually happens is that there is the proteolytic breakdown of the different tissue structures that actually starts, and it keeps on occurring until everything is being destroyed. You can see. Now, when the blood flow to a tissue is blocked, the tissue often becomes very painful within a few minutes. The greater the rate of metabolism, the more rapidly the pain actually appears. Why it is so? Because the more the rate of metabolism, the more the ATP that is actually being required, and the more the lactic acid that is being produced. So let's take the example of taking the blood pressure. When we are taking the blood pressure and the cuff is placed around the upper arm and is inflated, it actually can cause the muscle pain if we do not deflate it, like for within 15 to 20 seconds. In the absence of muscle exercise, the pain may not appear for 3 to 4 minutes, even though the muscle blood flow remains zero. The cause of pain during ischemia. What is ischemia? That is actually the lack of blood supply, lack of normal blood supply. Is actually there is accumulation of large amount of lactic acid in the tissues, which is formed as consequence of anaerobic metabolism, the metabolism without oxygen. So it is also probable that other chemical agents like bradykinin, proteolytic enzymes, they are formed in tissues because of cell damage, and that these in addition to lactic acid stimulate the pain nerve endings. Now, there is another cause of pain, and what is that? That is the muscle spasm. And it is quite common cause and is the basis of many clinical pain syndromes. This pain probably results partially from direct effect of muscle spasm in stimulating mechanosensitive pain receptors, but it might also result from indirect effect of muscle spasm to compress the blood vessels and cause ischemia. So we can say that the mechanical